Thanks for listening today. I want to be transparent with you. Besides hosting this podcast, I also work for Everly Health, our sponsor for today's episode. However, all views and opinions expressed on the podcast are my own or those of my guests, not those of Everly Health. Welcome back to Digital MD, the podcast where we talk to leaders in the digital healthcare ecosystem about innovation, decision-making, and how they think. I'm your host, Dr. Liz Kuo, and today I'm thrilled to have Paul Black with us. So Paul was the CEO of Allscripts for 10 years, and prior to that spent more than 13 years with Cerner in various executive positions. And he started even his career with IBM, where he spent a variety of leadership positions, being accountable for top-line growth, marketing, and professional services. Paul, I'm just excited to have you because these days you're actually a great investor and you do a lot of diligence on different companies. So I'd love to talk about how you transitioned to all of this.
Thank you very much for having me today. It's always nice to spend more time with you. I have been very lucky in the careers that I've been able to get people morph into, starting with IBM and learning a lot about technology from somebody who did not have a technology background and there really wasn't probably all that qualified coming out of undergrad or grad school to be able to take a job with IBM. At the time was a relatively technical company. 1 year's worth of training on the computers, on actually writing code, as well as a lot of deep skills on how to sell. Going from there, then when we decided we didn't want to live in New York long term, not all paths at IBM lead to New York. Went to work for a little company at the time, it was $100 million called Cerner Corporation. And it actually, I love that because I got to get back to my proclaimed roots, which were the healthcare. And I say that because that's what my father was, a director of pharmacy department at the University of Iowa Hospitals and Clinics for 43 years. And so I grew up, in his shadow, going with him on weekends and during, at night when he worked all the time. And I always wondered, what does he do? And I never really actually figured it out, quite frankly, because it's different going there versus going to my uncle's farm. Going to his farm is very easy to understand exactly what you do each and every day. Well, my dad was also an entrepreneur in that he invented unit dose, which is pretty cool when you think about the worldwide implications from a patient safety standpoint of having a very rote process about how you take care of medications and ensure at the bedside you have the right medication, that you're in the right room with the right dose, with the right person. Back then, they didn't have barcodes, but the early precursor of that was actually a physical cart that was filled in each cart on drawer. What drawer was assigned to a room, and that was the best way to ensure that you're getting the right dose and at least in the right tray, and that tray was associated with the room. So it's pretty fun, interesting stuff. And he always talks about it being simple, but it isn't when you think about what preceded it. And and today we think the Pyxis machines are all the lower, but it's certainly different. But then
so
I took Sorry, Liz.
I was going to just add. So with that, you said you're about to say you took 10 years working for Allscripts. Is that what motivated you?
I'm going to go my hiatus between Cerner and I retired from Cerner in 2007, and we read about it all the time when somebody wants to take time to spend more time with the family.
Yes.
I did that because I did want to do that. And I went from missing every single meeting, every single event, everything at the kids' school to being able to drive them to school every day, pick them up at 3:00 in the afternoon, go get some ice cream, and then go to baseball practice. I ended up being their coach and doing stuff like that. One son had just finished 3rd grade, one had just finished 8th grade when I was able to do it. And I tell people that the thing that I was lucky that I had a buddy who did the same thing, and he encouraged me to do it. I, of course, said, like everybody that's listening would think, I can't do that. And I looked at it and I said, actually, I can. And I did. And it's the best thing I ever did. And
can I ask, though, how did you plan for it financially? How did you plan for it time-wise? What was it in your career path that allowed you to just say, I can leave this and come back if I need to later?
Well, I had read one book on, financial independence, and it said, get your kids' education paid off, get your house paid off, get your cars paid off, and then, have a bank of savings. And at the time, don't have 6 cars, don't have, a bunch of car payments, don't have 5 houses and things like that, which a lot of people do these days, and lived a relatively simple life growing up in a simple place in Iowa. And I was able to, do that. My wife was working. She's a law school professor. So I had insurance, and that's always a big caveat that I always tell people.
Yes.
So I had that. And then I called the dude that was working with our money. We didn't have we didn't have $1 zillion, There's a
Hmm.
lot of people, it's easy to retire. But we had enough. And I just, as I recall, driving my oldest son home or driving away from the campus where we dropped him off his, freshman year and seeing
Wow.
the dome of the campus get smaller and smaller in the rearview mirror, I said, there's nothing I would do different.
Yes. That's incredible. And how then were you able to still, okay, so you had that stint, but then you went back to Allscripts. Were you able to still manage that kind of lifestyle with your son, your two sons, and being able to, get a grade report card every 90 days and be able to put up with that type of pressure? Because I feel like not everyone is able to go from what you had to like front facing CEO of a public company.
Um, that's a completely different, you know, it- intensity level again. And when you're the CEO, it's different than just being, the chief operating officer, the top line guy, if you will. And obviously, all the top line gets reported every quarter. But the as a CEO, you got everything. You got cyber, you got the people, you got the strategy, you got the capital allocation. And so all of that, whether or not you're doing it all, that's you're accountable to all that, including the board, as well as your shareholders. So you have a lot of constituents. You got employees, you got shareholders, you got the clients that you have that are very interested in what you're doing, and then you have everybody that you're interacting with each and every day. But so to me, that was a unbelievably vast set of responsibilities. But I loved it because I knew a lot of people that had done it, and I felt that I could do it as well.
And when you say you felt you could do it, what makes a good public facing CEO in your mind? Hmm.
Oh boy. Well, I think there's a lot of examples. There's a lot of examples of introverts. There's a lot of examples of extroverts. I'm probably more of the extrovert type,
Mm.
but people that are really good with building teams, building a culture, having, products and services that matter, caring about their people, caring about their clients, which sounds very trite, but there's, very distinct ways that you prove that each and every week. It was a pretty interesting time, underscore the word interesting during COVID, of how to communicate with
Yes.
everybody every week and make sure that you try to hold everything together when you have people that are distributed all over the world. We had 9,500 people, 3,500 of whom were in India, and everybody went home. And as you know, those were tough times. So
Yes.
from a culture and a business and a continuity standpoint, and people really hung on. I'm told, the weekly updates. So what's going on with the business?
Mm.
What's going on with us? What's going on with me? Just people wanted to be connected to something, and I've tried to fill a bit of that void. Then I also told them, look, you got 2 hours a day back, and I expect you to do some exercise.
Yes.
I don't know
Yes.
if they did it or not, but our Virgin Pulse indications would be that they did. We got a lot of points and a lot of steps during that period of time because we challenged each other each and every day, and it was always amazing. We had a very high percentage of the population that participated, so that the whole engagement thing I thought was also it was a good way to electronically track that, but importantly,
Yes.
electronically communicate with and engage with people all over the country or all over the world.
So this is fascinating because you transitioned through a lot of incredible roles, from leadership roles at Cerner now to Allscripts to influencing companies as an investor now, and then also being on boards. What are some key leadership lessons you find yourself repeatedly emphasizing? And we've talked sometimes about this, and I just think listeners could really benefit from how you hold people accountable. You're a sharpshooter, but you're also very transparent, and what you hold, I would say, are things that are just like non-negotiable.
There's a lot of things I think that are, if you will, non-negotiable, but the important thing is to really hire smart people. And I say that, again, I'm not the smartest guy in the room, never have been, but I've always surrounded myself with people who are. And it makes my job a lot easier if I have a lot of really smart people sitting around the table and I don't have to think through everything. As a matter of fact, they come up with better ideas than I do. And that's the way big companies work, because you have to have people that independently can go execute upon whatever vision is that we collectively have set for the company and the strategy that's going to incorporate the realization of
I
that
would agree
vision.
with that. I do think sometimes some corporations don't know that their leaders try not to hire people that could overtake them. But I feel like the greatest sign of being able to be a good leader is you're grooming people to take your role. because at some point, being able to move into the next one or setting the company up for success is important. But I think sometimes there are fiefdoms and people not wanting to hire people that are smarter than them.
100%. I actually worked with and have been around people that feel that way. And those are log jams. So the people that work for them, report to them, or temporarily report to them, see that in a nanosecond. And that's not a great environment for them either. I take great pride in the fact that while they would not attribute 100% of their success to me, there are 36 people that I worked with at Cerner who became CEOs and or
Wow.
are CEOs. And there's 11 people that I worked with at Allscripts who either were a CEO or are currently a CEO. And to me,
Are you
when I think
keeping
about
track of this data, by the way? How
my
do you know this? Wow. That's
relative
great.
names, if you want me to.
No, it's impressive that you just have the name or the
Well,
numbers
it's
right
important
off.
to me, so that's why I keep track. It's just
Hmm.
like anything else. You keep track of other KPIs in your life. You keep track of money. You keep track of other stuff, and But that to me is when I think about your a career, and I think when
Yes.
you look back on your career, what are you the most proud of? And to me, were you proud of the stock price? Yes. Were you proud of the growth of the company? Sure. Were you proud of all that and what the companies did? Especially in healthcare, it's pretty easy to get excited about what we were able to accomplish in that regard. But at the end of the day, I think our job, just like somebody took care of me and showed me the way and, boxed me in the ears a few times when I screwed up. Somebody's watching for me, watching over me and, mentoring me. And I think that's your job as a leader is to create more of you. And hopefully whoever you are as a good person from
Yes.
whom replicas should be made. So
Yes. I love
I think
it.
it's really important.
And just to understand too, you were saying that sometimes there's some things that are non-negotiable. So what are those in your mind that you would just hold your team accountable to and aren't able to like overlook?
Well, I think things like culture, and to me, a culture that's if you have a pay to stay culture, that's horrible. That's a non-negotiable. You have to have a
Mm.
culture of pay for performance as one
Yes.
thing. You get things around integrity. I always like to hearing other CEOs to say this, somewhat the same thing that I say. Integrity is a one and done. You don't get two shots on that goal. And I was very, very strict about that. If you had an integrity problem, it's going to manifest in some other way at some other time again. So you might as well get quote nip it in the bud right now.
Hmm.
Another non-negotiable for me is having coffee, a whole bunch of it every day. Another non-negotiable is I really do like to exercise. So that's
That's
out there.
great.
But from a
Yes.
business standpoint, just I really, really focusing on the things that you have to do to build a company first, to take care of the clients, to take care of the people that work at the company, and people that run decisions through a filter that goes through themselves, what's in the best interest of themselves first, and their team second, and the company third. That's the reverse order. And that's
Mm,
very easy for me to spot. And that
that's
is non-negotiable.
interesting.
That does not work. Well, you still work there, maybe individual contributor, but if you're in a leadership role, that doesn't work.
Yeah. Um, so you also talked about, we've talked about this before, reflecting on your career. As we talk about all these non-negotiables, but also how you think about leadership, what are some particularly challenging deals, either it's investment decisions or management decisions that you navigated that taught you about the art, either of deal making or of negotiating?
I think there's some concepts that surround that, I would say I've learned a lot from other people that I worked with, both in private equity as well as just at Allscripts specifically and at Cerner. And those are things around what do you do to create value? And value creation sometimes comes from taking cost out. Other times it comes from organic growth. Organic growth is very hard, but it's the cheapest form of growth that you can possibly have.
Hmm.
There's also a concept which is somewhat newer to me that I was very lucky to have a brilliant CFO working with me and President Rick Holton, and he actually understood the concept of value unlock. In
Mm,
that case, might be there's an asset that sits inside of your institution that could be better and more highly valued by the street or by other people, and sell
interesting.
that, take those proceeds, and plow those proceeds back into the company. As long as again, as long as you're not selling a huge piece of it, I think that's very important and very artfully done, and it's very difficult to do that. And luckily, I had Rick and others that worked with Rick, but Rick was the mastermind behind pulling the value unlock component. And then, thirdly, it's just making sure that you have a growth mindset, which is a highly overused term, but you have to
Yes.
grow. If you don't grow, you die. And
Yes.
it's been a publicly traded company. That's a fact. You have to grow double digits. Single digits are interesting. If you're not doing that, you better have very good EBITDA margins. And if you don't have that, you better have a lot of cash. And if you don't have
Yes.
that, you're going to.
Yes. Did you know that improving preventive care can significantly impact your health plan star ratings? Everly Health Solutions is the leader in at-home testing for health plans. Their convenient, member-centric approach has helped plans achieve industry-leading results. In just 1 year, Everly Health Solutions helped a multi-state Medicare group improve 15 of their plans by at least 1 star. That's a win for members, providers, and the plans themselves. Learn how Everly Health Solutions can elevate your health plan at everlyhealthsolutions.com. So I think also for listeners, it's useful for people to understand organic growth is, as you said, is slow. Usually it's development through, increasing your either sales price, your market share, or like you're trying to earn profits even during economic downfalls. But for specifically inorganic growth, that's like usually M&A and mergers and acquiring companies. So how do you balance the two? How did you do that even at Allscripts?
Some people have a formula for that. I don't know if it was formulaic at Allscripts. As some people say, if we want to grow 30%, we should get 20% out of organic growth. So
Mm,
that's new sales, and quite frankly, that's new business. So those are new logos. It's it's not the same store sales or cross selling into existing clients. But a piece of that is taking some developing new products and then
yeah.
selling that back to existing clients is also that's part of the overall, if you will, drumbeat of how businesses work.
Yes.
And most businesses spend a lot of money on R&D, and if that R&D investment are not manifest in new sales or cross sales, then you're probably investing in the wrong thing, or you're not getting it to market appropriately or effectively because you're spending a lot of money on R&D, on more software, if you will, or more capabilities.
Right.
The inorganic
Right.
component is buying adjacent products or adjacent services. In some cases, they're competitors. In some cases, they are new capabilities that you have determined it's going to take you longer to build than,
Mm-hmm.
or yeah, so therefore you could go buy them. And we
Yes.
did that a couple of times because we thought there was a very important need to have some platforms that we didn't have. And we thought that we could go buy them and incorporate them into the broader vision and be able to make that happen in a much more, expeditious time frame by buying it versus building.
That's great. I feel like that's a really clear. I mean, there's a lot of great books on this, but I also feel like it's nice to hear from executives who've done it and done it well. Uh, Last few questions I have then is what advice would you give to entrepreneurs, speaking of them, people that are listening in, looking to innovate in the healthcare technology space? You and I have talked about it's such a great time to be an entrepreneur in health tech right now. What advice would you give them? And then number two, how are you looking at your investments too when you're looking at health tech?
Sure. I think the advice for entrepreneurs are, and I say that having never been an entrepreneur, so I'm always careful to, foreshadow any comments with, look, I've never done this or done what you're doing, taking two nickels together and come up with an idea, get it funded and go try it. But if you could get a channel as quickly as you can, i.e. working with somebody through your venture firm or through your contacts to be able to get you into a channel and get into that deal flow more quickly to get clients is, I think very important. Number two is that you have to really focus. There's going to be so many zillions of ideas that you have out there, in whether it's Deming or other people that have done studies on quality and the human brain and capacity. It's
Mm,
very difficult to do 7 or 8 things at once, to do 1, 2, or 3 things well, and to go do those really well before you move to the 4th, 5th, and 6th, I think is also extraordinarily important. I've been working with a lot of companies, and my instinct is always to, gen up 50 other ideas, and you just have to stop, let them do what they're doing, let them make progress on that, and then come back with the other great, wonderful ideas, especially that a board is going to have, because they've seen
great.
this once and they've been in, the other meetings with another, sector of the industry, and they think, well, this would apply there. And you have to be very careful about getting too much advice about where else to go versus what your gut is telling you to go do. And most
Yes.
of what you're doing is based off your gut. And you have, if you're entrepreneurs, trust their gut. There's a lot of very successful people that have made big businesses because it didn't exist before. And if you listen to, pundits or you listen to consultants, they're going to say that won't work. But if you know
Mm,
in your own gut that it's going to, and that's where you want to make the investment and you have conviction around it,
yes.
do it. We live in a digital world that digital world did not exist, 15 years ago. All of healthcare, providers as well as payers, are now completely 100%, 99% digital. That creates huge opportunities for entrepreneurs. Those digital highways that are out there have all sorts of information flowing back and forth. The exhaust fumes, the data that are there
Yes.
are highly valuable to not only pumping back down into that highway, but taking to another highway and go building something else. I think what those data sets that are there that I think are very fascinating. From an investment standpoint, it's overly trite, but if you're not working on something that incorporates artificial intelligence,
Mm-hmm.
large language models, understanding how that's going to impact you, understanding how that's going to impact your company, understanding how the usage of that will help accelerate your adoption in the marketplace, I would think that you might not be working on the right thing, or you at least have to have a view for what that looks like because of the valuations that are there, but importantly, because of the disruptive nature that they are going to have and you're currently having in many industries, including healthcare. And if you're building something that could get disrupted by that at some point in the future, usually it's going to be sooner than what you think. You're probably not thinking broadly enough about the applications that you're building.
I agree, especially when you can use ChatGPT to make birthday songs over a dinner at Health Evolution. Um,
Absolutely.
but I absolutely agree with that. I think there
Yeah.
is no better time to be an entrepreneur, especially my goal also of writing the book Digital MD and you being the forward for it, which I'm very honored to have you, was to focus on helping entrepreneurs and clinicians and those that are, in the superperiphery, be able to jump in and dive in and say, now's the time. I know this. I can connect the dots. I can use tech, and I can really kind of solve these patient outcomes and problems that we have in this
Yeah.
country.
I think it'll absolutely identify things more quickly, and it'll help the caregivers that are, completely overwhelmed today, being able to, give them a bit more focus on what they're trying to get done already and get a lot of the noise out of the way. If these things can help give them the pertinent data that they just want to see, and
Yes,
they've always have wanted the computer to work for them. Right now, they will all assert that they are working for the computer, and that is a reversed algorithm, and that needs to get fixed, and it needs to get fixed in a hurry. I'm not
yeah,
worried necessarily about the burden and all the other things that people talk about. It's fast and it's there. I think the converse is the opportunity is huge to be able to take care of some of these, capabilities that exist today, to be able to present a summary of, a vast amount of information to give these, people that are extraordinarily highly trained and
mm-hmm.
who really care about their patients, give them the information they need to make the clinical decisions that they're going to make, and have better conviction around that, and better data and better science around that as they are continuing to make those complex decisions that they make each and every day.
That's right. I call it artificial intelligence, not artificial care, but augmenting care. So being able to streamline things faster, reach into medical records, pull out summaries, pull out details, and then focus on the 5 Ps: predictive, personalized, also prescriptive, and then, which I also talk about in the book, which is all the different Ps when you're thinking about the ways that we're going to change the way we look at it proactively in helping preventative care happen.
Yeah.
So,
At the center of it all is a big P, the person, right? And
yes,
no, there's nobody that wants to be a patient. People want to get back to the status they had prior to getting ill, prior to having a
yes,
problem, prior to having an accident. They all want to they want to be talked to, and they want to get back to person status and get away from being a patient.
that's right. I've definitely been there. So, being a patient myself. So, Paul, it's been an absolute pleasure. Thank you for being here today. Before we wrap up, we always ask our guests for their hot take 5 questions. So, best advice you want to give?
Hire really smart people.
Great. Favorite business or life quote?
Don't look back.
Oh, I like that a lot. I don't do that either. I don't look back. Hardest challenge and how do you overcome it?
Making a bad decision and then fixing it.
Hmm. What's most exciting for you about health tech innovation right now?
The fact that the interstate has been paved, healthcare is digital, and the fact that we can make decisions so much more quickly and be much more effective for the caregivers that are out there that desperately need some relief.
Great. If you could have any superpower, and this is the last one, what would it be?
Oh, it takes me back to the little vignette inside of It's a Wonderful Life. I wish I had $1,000,000. Luckily I don't have to worry about that. But I really want, I just want the healthcare platform to be able to realize the full potential that it has versus all the negative, commentary that's out there that we spend 22% of the GDP and we don't get the right results. Just for it to really, my superpower would be for us all to realize that full potential, because it's there, and it's not for the lack of trying, and it's not for the lack of people who care about that. That's the thing to me that is the most exciting about the opportunity, and the reason why I'm so optimistic about this industry. It really matters. People that work on it care, and there's a lot of great opportunity for us to all make a big impact on it.
That's so great. Couldn't have said it any better. So, Paul, it's been an absolute pleasure discussing the healthcare landscape with you. So, listeners, for more on Paul's work, connect directly with him on LinkedIn. We'll link in the show notes, and we hope today's conversation has sparked your curiosity to inspire you to explore further. Thanks for joining us. And until next time, keep on innovating. Thanks, Paul.
Thank you very much. Buy Dr. Kuo's book and enjoy your holiday weekends. Take care.
Thank you.
Bye-bye.
Did you know that improving preventive care can significantly impact your health plan star ratings? Everly Health Solutions is the leader in at-home testing for health plans. Their convenient, member-centric approach has helped plans achieve industry-leading results. In just 1 year, Everly Health Solutions helped a multi-state Medicare group improve 15 of their plans by at least 1 star. That's a win for members, providers, and the plans themselves. Learn how Everly Health Solutions can elevate your health plan at everlyhealthsolutions.com.